Our hope is that the Hastings Center Cunniff-Dixon Physician Award will begin to change the culture by calling attention to the outstanding work of physicians. The reward structures of American medicine tend to go towards the doctors who do a lot of procedures. But for patients and families, some of the most profound and important interactions with physicians are going to be around end of life.
The purpose of the award really is to recognize physicians who have demonstrated a serious commitment to the field of palliative care and medical care near the end of life.
The Duke Institute on Care at the End of Life works with the Hastings Center and with the Cunniff-Dixon Foundation. We've organized a review process, and so we make sure that all nominated individuals meet those criteria, and then we very carefully select the awardees.
You know, it's really our job to be sure that we find a way to support children and their families through that. So I think that while the time isn't readily there, I think we have to make it.
My decision to go into palliative care crystallized as an intern. I was taking care of, I remember a series of older patients on the general medical service, and I felt like we were doing a lot of things to them without necessarily asking them what they wanted or would have wanted at the end of their life or at that period of their life.
Right.
And I felt like there was a lot of suffering that we weren't addressing.
I really felt when I was in a position to try to prolong life as much as possible, despite what the quality of life might be, I did not find that satisfying. I felt like I was delaying the inevitable and slowing down somebody's death, but they were still going to die. And along that path, I was going to do procedures and send them for studies that were creating pain and discomfort. And I thought there must be a better way to treat these patients.
We do a lot, I think, in pediatrics of protecting the child, and that's something that the field of pediatric palliative care is working very hard on, trying to find that balance of protecting the child from things that are stressful, sad, difficult about having a chronic disease, but also really having a voice and having a say in what kinds of treatments they'll choose.
Hospice palliative care is a beacon, and it's a refuge.
Palliative care is practiced, needs to be practiced as part of a team, and there is no way that I would be here or we would be here without our teams.
There's a difference between treating a disease and dealing with the patient's illness. You know, diseases, we teach, occur in organs, and illnesses occur in people. The thing that's always been most rewarding to me is to be able to treat illness.
If we have the opportunity to impact our culture and change the way we look at the end of life, I think we should grasp every opportunity to do so.